Hi, everybody. I am Carolyn Chudy. I'm a physiatrist. I work with patients with pelvic pain. And I have with me today Marina Castellanos, who treats patients of ours that also have pelvic pain. So, welcome, Marina. Can you tell us a little bit about yourself and your practice?
Sure. Thank you so much. So my name is Marina Castellanos. I have a pelvic health practice in Westchester County, New York, and I mainly work with women, teenagers, and I also work with children.
And so, can you tell us a couple of interesting treatment options that you might be able to offer patients? So, for example, what's going to happen in the first visit when they come to see you, and what might they expect as a treatment from you?
Sure. So in the first treatment with me, really that initial assessment, it's a long visit. I see people in person for 90 minutes. So really what that does, it just gives us ample time to, go over a person's history, so that they're comfortable with knowing with me knowing the background, and, gives us plenty of time to do not just the pelvic floor exam, but really a holistic physical therapy exam. So I look at somebody's posture, how they move, how they walk, how they do some functional movements like a squat. I look at their general range of motion and their strength. And then after all of that is complete, then we move on to a pelvic floor evaluation, which starts with an external evaluation, just looking at, in females, the vulva, just looking externally at the tissue, and then doing an internal exam, which really is done very gently, just with finger. There's no stirrups or speculum involved, and it's always done, of course, with patient consent. If somebody doesn't feel ready to go ahead and do that the first session, it's okay. We hold off on it. In some cases, maybe a rectal examination is done as well, just depending on the person's condition. And then really after that whole assessment is done over that 90-minute period, then I talk about the plan of care with the patient, and we start talking about some things to implement at home to already start improving their symptoms and just start addressing their condition. And then usually I have people come in to see me once a week for a couple of weeks, just so we give them a head start on, seeing some progress already. And then, as time goes on and progress is seen, then we might, I might kind of wean them off a little bit and they come in less frequently.
That's great. I think that's really helpful to have patients coming in initially more often and then a little less frequently as you go. Could you give maybe an example of something that you give patients to do at home, sort of the homework that you give?
Sure. So probably the number one thing I give to everybody who comes in with pain is really breath work. Just working on connecting that diaphragm with the pelvic floor. I'm working on some diaphragmatic belly breathing. When you're in chronic pain all the time, your breathing tends to become really shallow and tends to happen most often in your chest and above, and like some of your accessory muscles around your neck. So a lot of people tend to be tightening up their abdomen and their low back. So really just kind of bringing about some mindfulness and awareness to those areas really helps the pelvic floor, even though we're not directly doing, anything to the pelvic floor yet. So that's probably the number one thing I give to everybody. It's just some simple breath work. And even though you say it's breathing, it's not always easy to figure out. So a lot of people have difficulty just connecting with a deep breath. As shocking as it may sound, it's really true. So working on that also helps to tell our nervous system to calm down a bit. When we're in chronic pain for a while, our brain just sort of adjusts to being in that constant state of pain. So working on that breath work really helps to tell the nervous system, it's okay, let's take it down a notch, let's try to relax, and it's okay. And, we don't have to be in this stressed and anxious, wound up mode, quite so often.
Which is huge for patients with pain. So that's
Absolutely.
great.
Yeah.
So what would be some conditions that an adolescent patient would come to see you for?
I've had teen girls come to see me with, pending diagnoses of endometriosis, pelvic floor pain related to their sporting activities, nerve pain, constipation, fecal incontinence, bedwetting, and really with the constipation, comes, some abdominal pain and bloating. So sometimes it takes a little bit of detective work to find out what's going on and the source of the pain, because even though they're having bowel movements maybe every day or every other day, somebody could still be backed up. So that may not necessarily have been, inspected before coming to see me, but could be a source of pain. But those things I would say in terms of pain diagnoses, I'd say like endometriosis, pain related to, sporting activities, and constipation are probably the most.
It's great that you treat teen patients, because I know there are a lot of therapists that don't actually see adolescents. And I imagine it's difficult for a lot of teenagers to come in knowing that you're going to be really dealing with a sensitive area. So is there something that you do to make those patients feel comfortable in your office?
Well, I tell the parents, because when somebody's a teenager and under 18, I go through the parents, their legal guardian. So I always tell them before they come in for that first visit, what's going to happen, what to tell your child, how to prepare them. And then it depends on the child. So if they're coming in and they're absolutely terrified, which has happened, much doesn't happen on that first session. We're just talking, we're just being in the room together. I'm talking to the parents. If the child outright refuses to let me touch them, then I don't touch them. We're just going over some other things that they can work on without hands-on therapy. Other children have come in who, much like adults who've been in pain for years, they kind of say, all right, I've had enough of this. Let's, what can we do? So it really depends on the child. One thing to note is that, internal work is never done on a child or an adolescent. In the rare cases that it's called for, it's only done with, doctor, parent, and child permission. So I've never done an internal on a child. And even to have them, exposed to do something on the outside of the genitalia, like biofeedback, it's still only done with consent. And sometimes, they don't want me looking. So I do things through the parent. So I have the parent kind of just, describe to them, what to look for. And, I'll stand by the child's head and I'll say, okay, this is what your mom is going to look for, your dad is going to look for, and things, might go better that way for the first couple of sessions before they get to know me more.
I think that's hugely important in this, today's environment with, so many teens being exposed to inappropriate conduct. And I think, you have a very professional environment, which is so helpful. So is there anything that you want to share with patients who may be afraid to come to physical therapy?
It's really the biggest thing I always tell people on the phone when they call ahead. Everybody wants to know what's going to happen, and they're kind of envisioning, a scary scenario. And then once they come in, when they leave, they say, "Oh my goodness, I'm so relieved. This was so great. I was so nervous before I came in." And I say, I understand, because this is something that's very new. Most people have never been to pelvic floor physical therapy, even though everybody probably could benefit from it in one way or another, especially if you've had babies. But just going through that dialogue before, people coming in, telling them exactly what to expect, and then just going through things like step by step during the course of a session, really helps. Just telling people everything, what's going to happen, and just keeping them constantly informed, having them always, be in control of what's happening to their bodies in session is super important, and really just helps everybody to feel so much more ease.
Great. Yeah. And you do a fantastic job. So thank you
so
for all the work that you do for our patients to get them better, and having such open communication with us so that we can really all work together to get patients better. So is there a way that patients can reach you for treatment? What's the best way?
Sure. So my website is www.marinacpt.com, and you can follow me on Instagram. My handle is Marina C Pelvic PT. And probably that's the best place to follow me. And then I also have a YouTube channel that you can link up the Instagram site, and a Facebook account too. But really Instagram is where you'll find most of my content.
Great. Thanks so much.
All right. Thank you so much for having me.